Hi, everyone, and thank you for joining. I'm Christina, and welcome to our latest webinar, Leading the Digitization Journey in Social Care. We've got Richard, we've got Mark, we've got Liam today, and we'll be getting ready to start. First, I'm just going to do some really quick housekeeping, so bear with me. As you know, the chat function is available. Everyone can comment. We really encourage you to, interact with us, leave us any question at any point in time. We encourage, obviously, comments, questions, everything. We'll be also posting a couple of polls throughout the conversation, so keep an eye out for those ones. This webinar is going to be recorded, so no worries on that. We'll be emailing everyone who registered a recording afterwards. And we are also supposed to add that all the views expressed today and the webinar and presentation reflect only the speaker's views and not the wider views of their employer or their organization. So thank you for coming. Thank you for joining. I will now hand it over to Richard.
Fantastic. Thanks so much, Christina. Before we get into it, good chance to start practicing using the chat. I hear that we've sent out festive brownies to the lucky audience. So, like, if you're tucking into a festive brownie, please let me know how it is. They didn't arrive on my doorstep, which was disappointing. But yeah, are they better than your regular brownies? And is it too early for Christmas festive things, Mark? Do you have a steer for me? For me, until December starts, it's too soon for Christmas. But how about yourself?
Oh, do you know, I'm torn down the middle. So myself says no, but I've got 3 young children. So in that respect, yes, because the second you start talking about Christmas, it becomes a bit chaotic. But yeah,
exactly. How about you, Liam?
I think the minute you hit December, so I'm just kind of holding off slightly, but yeah, I'm just that sort of feeling is just bubbling up,
Fantastic. And the chat is alive with, apparently the brownies are really good, so I take that as some consolation. Cool. So yeah, we're here to talk about leading the digitalization journey in social care. Before we get any further, let's all just do a quick round of intros. So my name's Richard. I'm the head of product here at Sona. But prior to that, I spent the last 10 years in the health and social care sector, responsible for sort of 21 care homes and the tech involved. So I was procuring and implementing tech solutions and rolling them out, ultimately trying to make the residents' lives easier, the staff's lives easier. So that was my background before coming and joining the product team at Sona. How about you, Mark? I guess when did you join social care and what got you into it?
Yeah, so I joined working in social care when I was 17 years old. I volunteered in a learning disability service that was just down the road from where I lived with my parents. And I just fell in love. I didn't see it as a job at all. And I deferred from going to university. I'm now a regional business manager for a re-enablement provider and co-founder of The Caring View, which is an online social care platform for anybody working or wanting to know more about social care.
Fantastic. And Liam, would you like to introduce yourself?
Yeah, certainly. Liam Palmer, and I've been in healthcare for the last 11 years, running private hospital, retirement village, and then in the last years, care homes and nursing homes as registered manager and regional manager. Also, I've been helping to launch a care tech guide, which is about helping care providers find and research good tech, just to add to the other resources and great work already out there. So that's kind of me. Yeah.
Fantastic. And I don't think there can be enough good resources. I think it can be a bit of a minefield, especially for the less tech savvy that know now that maybe the answers are there, but where do you go and what do you do? So to start with, we'll do a quick round of like our experience or sharing some of our experiences with digitization in social care. The joy of me getting to host is I get to go first on this occasion. So as I said, I brought in sort of a number of systems. My aim ultimately was it's more than just storing what you were storing on paper on a computer. Like it had to add value to the residents' lives, and usually that meant adding value to the staff lives or giving the staff time to be able to provide that care. But also the visibility. So I'll only share 2 stories. I promise I won't drone on. Implemented sort of a care planning solution to start to just try and start getting oversight. So that was largely collecting the same information we were on paper. But when you can suddenly have that power of big data, I would call it medium data, right? When it's all of your care homes, but you start to be able to see when when are these accidents happening? When are these incidents happening? And then make changes off the back of it. And it was like, we always knew that people were falling, or we had these accidents, etc. But until you start to collate it in one place, and to do that before used to take people days, weeks to get these pieces of paper, shuffle through them, start to work out, oh, maybe there's a problem at handover time, for instance. And suddenly, as soon as it was digitalized, you were just like, oh, obviously, here's my spikes on my graph. Here's what the data looks like. So for me, the visibility of digitalizing was fantastic. But then I guess perhaps another interesting experience, we implemented recruitment, an ATS system. That was about 7 years ago now. And the last thing I did before I left care was re-implement an ATS system. That was how I knew my time had come, when I'd done the full cycle and I was replacing systems I put in. But it was fascinating because the difference with digitalization in those 7 years was our first system didn't have an app, didn't have a way for people to sign up. And in that space of time, it was like you weren't getting candidates. A recruitment system that you weren't getting the volume or the quality of candidates just because of the tech, because of the digitalization. So it was actually around, you need sophisticated systems in place, because ultimately that's what the staff expect. That's what we use day to day now. So that's the expectation in work as well, or certainly that's what I found. How about you, Liam? So you've started the Care Tech Guides. I'm sure you've got some thoughts on what is digitization in social care to you?
Yeah, I think there's two levels. Thank you, Richard. Specifically, being a registered manager of a 70-bed home a couple of years ago, and helping them on their digital journey. So that was an enhanced nurse call type system. That was a rostering system, and that was a care monitoring system. And so it was, from no digital whatsoever to, two extra layers, I would say. And I think that there was a number of really interesting learnings from that. So putting in an enhanced nurse call system, there was more tech in it, and at the time, the care provider was sort of being a bit critical of the supplier, because there were some teething issues when it was implemented. But then they went a little bit anti the supplier, but actually they were just teething issues. So it's about talking about expectations and the implementation of a quite complex bit of tech, a bit like getting a new car or a new thing. It needs to be bedded in, it needs to be supported. So that was a bit of learning. The rostering system was really fascinating. Because everybody had, bits of paper, stuck on doors all over the place. And nurses were like one world, and residential was another world, and never the twain shall meet. And they were, typing up Word documents and printing them off all the time. And it was quite funny because we implemented this, quite good rostering system. So you can book holidays on it, and you can keep track of your hours and all that useful stuff. And at the end, my nurse lead was still using bits of paper. And I was like, well, what part of we've implemented, we've spent money, we did the business case, what part of that is not clear? But she didn't want to use tech. She was so used to these blasted Word documents. So in the end, I had to write an HR policy addendum, which is, this particular home now uses this tech, you are required to use it. And at that point, she complied. So I thought that was, quite an interesting learning about how do you bring people with you, and the fact that people, can be wedded to what they're used to. And then finally, with the care monitoring type solution, it's really interesting. We had some carers there, beautiful people, who didn't even use mobile phones. They were pretty non-tech savvy. So we had our sort of handsets there, and they were feeling, understandably anxious about using tech, and how it was a bit scary and stuff like that. And what was really rewarding for me as a registered manager, and doing some of the work to sort of digitize his home, was that a few months in, once it was bedded in, he was much more confident as a carer. He was more confident because he had great information to hand. What he realized was it reduced the risks and it made him more competent. So actually there, for me, that was a kind of penny dropping about good tech, well applied, well chosen, can actually, help care services run better.
That's fantastic. I think you've talked us through the full change curve there as well, with sort of the resistance to trying to buy people on board and then actually seeing the upside when it's implemented. And we'll talk more about those areas throughout the course of this chat. How about you, Mark? What's your stance on sort of digitalisation in social care, and what have you done lately, perhaps, where you are now?
Yeah, I'm all for digitalisation. I think it's the way that as a society we're going, it's going to be the expectation of relatives and loved ones. And I think as we see the population aging, we're all using tech now. It's going to be the standard and what we come to expect within the care services that we use. I think my very first experience was probably about 7-8 years ago when I was at Bluebird Care, and they rolled out Every Life, which back then, it's still on the market now. It was obviously very revolutionary, very different. And I think it really transformed the service that we had and like we've spoken about already, the data that we were able to give us, and just to be able to utilise that to identify trends and to make business decisions and communicate easily with the frontline staff. I've also equally taken over services that have had a digital solution that isn't right for that organisation, but I've seen the fallout that creates, where you've got people that aren't engaged with using systems, unhappy staff. It comes through in the staff surveys. You're tied into normally like 3-4 year contract, and it's really hard as a business to then remove that and put something in that works whilst balancing obviously the staff expectations. I think we always think about care planning, don't we, when we talk about digital care? And I think there's so much more as well around like the telecare, the telehealth, there's smart clothing now that you can use. And I think all of these things are very kind of slowly easing their way into social care. But I think give it kind of 5 years, it will just be the norm. And I think, things like smart clothing, I don't know anybody that's doing it at the moment. I've obviously only just read articles and seen people talk about it, but not actually seen a provider utilising that for people with dementia to reduce falls and that. I think the learning and the care outcomes that can come from that are going to be really beneficial.
No, I completely agree. I think as soon as you start to look at the things that are coming, and it is bigger than care planning, right? But also I think you touched on an important point. I don't know many care providers that haven't been burned before, like you say, about that misfit of a system that's not quite right or not engaged. And I think that's one of the things that then puts a barrier to actually all of these new potential benefits. It's like, but we did something simpler and it didn't work for us. So as a provider now sitting on the other side of the fence, we try and do a lot of work to try and comfort, assure people, tech's moved on, things are different, but also like we only want to be the right provider for people because it's in everybody's best interest. And the more providers that are on that wavelength, hopefully we can bring the industry up and people will be more open to some of this fantastic stuff that can really help the residents at the end of the day, or the people we support. Cool. So moving on, when you're choosing a digital care solution, we talk about people have been burned before or it not being a right fit. Like what matters? There is a lot out there in a lot of different spaces. So Liam, I'll start with you again before I weigh in this time around. But yeah, what sort of 2 to 3 things do you think leaders should be aware of before choosing a digital solution? Oh, you're on mute, Liam.
Sorry. Yeah, I think, as you said, it's it's a fast evolving market. In terms of some of the considerations are kind of do you go for a best in class single solution, or do you go for a solution that has sort of multiple purposes? And so for example, you can get a care monitoring solution that also does invoicing and might also do building management and some bits and bobs. So there's kind of arguments. There's kind of cases around those different things. So for example, by having a combined system, it might be less expensive. So that's the kind of plus side. The possible minus side is there might be less development put into each part of that versus a specialist. So that's one of the considerations. For care monitoring, it wants to be on the assured supplier list. So that's an important, consideration. And yeah, I think that in terms of choosing a system, another consideration is whether it integrates with others. So that's something to look at. And then you've also got the kind of reviews of the tech and the kind of reputation of the suppliers, and that's important. It's important. Mark raised that point about unfortunately there has been, I think, a bit of mis-selling over the last 5 years or more, where there's maybe been 1 or 2 extra promises made, and the difficulty for the care provider is, who do you know to trust, who do you know to listen to, which is another matter. But that's a few things to consider.
Fantastic. I'm just going to pick up on one of those points there before I hand over to Mark. I think the integration bit is so key for me. It's not even necessarily a case of do they, it's defining the boundary of the solution. Again, you talked about this sort of maybe an all-in-one versus a point solution that specializes. And as you say, pros and cons to both. But for me, it's important to understand what the integration will need to do. Ultimately, I don't believe there is a system where it does absolutely everything you would need sufficiently. So you are going to end up in a world with more than one tech solution, be it care planning versus scheduling or whatever that divide may be. And especially to Mark's point, if we start bringing like wearable clothes and all of these other systems, you're going to end up wanting them to talk to each other. And clearly defining that boundary is important and understanding it before buying. As in, can a HR system talk to a scheduling system? Almost certainly. Can they pass sickness across at the right granularity? Do they have things in the same way to mean that you're going to be able to run reports that make sense in certain places? Do they pass things in real time, or is it the nuances around how you pass data? So then maybe HR and scheduling belong together. And then you think about payroll. Well, payroll is usually an export. Maybe that's a safer boundary. Maybe I'll draw the boundary there because I can do everything in scheduling and HR and output number. And again, often you do see that work. Sometimes with more complex payrolls, you may need those two things closer together. So depending on your setting would depend where you want to draw those boundaries. And even with care planning and scheduling, I believe, I don't think this is fully utilized anywhere, but imagine if your scheduling started to know who was on shift when you had these accidents. And this is when you start looking back over some of your care records, if you had immediate access to all of that scheduling. And again, they're likely to be two different systems. There are things that do them both. But it's like, if you can get a sensible data exchange, if as providers we can build these partnerships, the value add, I think, for the customers and for the staff would be fantastic. But sorry, Mark, how about yourself? When you're looking for digital solutions, what sort of 2 to 3 things that are you looking for?
Yeah, I think for me, it's reviewing why you need it. So what is the business case? So we know that the government have their ambition of percentage to be digital. I think we know that the CQC, that whilst they're not going to mandate it, will expect providers to be utilising digital for the data and the learning that brings. But actually, I know that there are some learning disability providers where actually there isn't that need. If you're supporting 1 or 2 people, the cost far outweighs the return on investment. And also, people's capacity, actually you might be supporting, people that don't want a digital system. They don't want their details being inputted. So I think from a business point of view, you really need to think about actually what it is you're trying to achieve and what that long-term plan is. I think you want to think about cost. So there is funding available at the moment for digital softwares, but I think tying into costs around actually what contracts are you going to be looking to get into? And I think that takes you back to kind of that business need, because if you're currently in position X, but your business is going to be in Z by the end of the year, will that contract that you're with that digital solution actually be able to take you there over that period of time as well? Or actually is your business going to completely change to what you currently are? And whether that digital care planning software or whatever that digital solution is that you're looking at, will it be able to adapt? And I think that brings me on to my last point, which is the roadmap that they have. So Liam obviously spoke about the assured solutions list. So all of them should have a plan in the pipeline of integrating with GP Connect and that kind of thing. But actually, if you've got something really specific, and I kind of think about my own organisation where I work, is that we are very niche. It's reablement. It's up to 6 weeks care. So the throughput of customers is great. And we can be supporting, in 2 contracts I oversee, over 200 people in any given day. And actually, can the software keep up with the demand of all of that data going in? Can the cloud cope? And I think they're all little things that you don't necessarily think about when you're actually just very first looking. So I think just have a look at the roadmap, but also speak to other providers and see what they recommend. But don't go with, obviously, a Facebook group where somebody says, don't use X. Make sure you still meet X, because it might not work for one person, but it might work really well for you.
Yeah, I think I couldn't agree more with everything. There's a lot to unpick. I really like the idea of that for the first level of that. Actually, do we need this? It's not just going along with it, going, oh, digitalization, does it add value to our business? is it going to continue to add value to our business? And I think that last point as well is like, are our priorities aligned with the provider? Because I agree, and that's how you don't want to be changing providers every year or 2 years. It's a huge undertaking. There's a cost, etc. You want to make sure that, hey, once I pick provider X, I believe at the moment with the business case and with their business case and plans that this can look good 2, 3, 4, 5 years out and further. I think that's an excellent point. So another angle, and Liam touched on this, I think. When you've chosen the solution, it's time to roll it out. How do you communicate those benefits to the wider team? And I guess there's 2 levels, isn't there? There's sort of management, which are often closer maybe to the decision and closer to the process, but then you've got ultimately what's often the end users, right? The staff, the frontline employees. So how do you go about communicating change to them to try and avoid people continuing using those Word documents, or to have the people that actually can't use the tech or aren't going to? Mark, do you want to kick us off?
Yeah, absolutely. I think for me, it's all around communication. And I think we always say, communication is key. I think I've worked for small providers that have implemented digital solutions and large providers. But I think for me, it's all around involving all your employees into those decisions and utilising different communication methods, whether that's you're utilising Teams or you might have, software in place to communicate, but actually just keeping people updated. I think meeting with them on a regular basis to talk about any concerns they've got, and listening to Liam earlier with that nurse that didn't want to use it. Actually, if you had somebody like that in your organisation, why don't they want to use it? Is it a fear that they can't use tech because it's a generational thing? Is it because they believe that paper is better than digital? Look at what you can do to upskill those people to actually come on board with you. I think there are going to be times if you're implementing something into your workplace that's very new, there's a lot of people that don't like change. And I think, unfortunately, off the back of that, there might be performance management routes that you have to look at. I wouldn't advocate that. I think that's the last kind of case scenario that you want. You ideally want to be bringing people on board. I think if you're rolling out something, if that software provider or whatever that digital solution is, if they can offer something in a test mode so that your staff can kind of really tangibly play with it, then they can get an idea of what it's going to look like, feel like. Because I think sometimes you think digital and you think, oh God, it's going to be really scary. But actually reminding your staff, majority of you are on Facebook, you use WhatsApp, and actually this is not going to be really too different. And I think a lot of the digital solutions that are out there now are trying to kind of piggyback on how easy, the everyday tools that we use are, like Facebook. I think quite often a lot of the providers will talk about that. Actually, we've got this system, but actually if you can use Facebook, you'll be able to use ours. I think providing training and resources in different formats. I think, it's all well and good for the digital solution to give you a handbook, but are your staff going to really have the time to read it? Do they want to read it? Even if it's 10 pages long, it's still 10 pages. Actually, could you have them create you a cartoon or some visuals or an infographic or something just to kind of break that communication down? And I think it's just that continuous feedback loop from your staff. Even once you start rolling out, how's it going? What are the T's and issues? And making sure that you're kind of present and there to then identify what those issues are, take them back and communicate what you're doing to try and resolve it. And there will be some things, undoubtedly, that you can't resolve. Actually, if it's out of your hands and it's sat with a care planning software provider. But I think what you can do is you can emphasise with what your staff are saying, but be very honest with them and saying, actually, we're meeting with the supplier and they've said this, we're going to try this, it might not work, and actually might have to go back to them. I think it all comes back around to kind of communication and involving those staff in all those decisions.
That makes lots of sense. I'm just going to pick up specifically on the handbook and the training. I think that's something that resonates, and not dissimilar to Facebook, right? Our view is always, I say this a lot, no one ever taught anyone how to use Facebook or WhatsApp. But also that ease of use has become the bar now, I think, for certainly workforce management and digital care, digital tools that the frontline staff are using. It's not that if it's not as good as WhatsApp, that it's a problem. It's fundamentally broken. That's not excellent anymore. WhatsApp, Facebook, that's become the bar of what these people are expecting to engage with. And so as a provider, you need to meet that bar and keep training and keep things simple. I also love what you say, over communicating. If there is a problem, it's like telling the whole staff, hey, you've raised this, we're meeting with the providers, we're doing these things. It's just keeping the dialogue so that the staff know what's going on. Before I come over to you, Liam, I'm just going to unpick, there's a few fantastic comments in the chat I just want to shout out. I think Ellie made a really good point that I glossed over at the beginning, that management might be closer to the decision, but it doesn't mean that they're brought into it. And that's something that I certainly saw an awful lot and tried to improve over my time of implementing systems, just being like, well, of course managers are going to love it, it's making their life easier. That's an assumption that I, from personal experience, is a dangerous one to make, communicating to the managers the benefits. And especially sometimes when you have groups that are involved in the procurement process. And obviously not everyone's aligned, right? Normally somebody wants provider X, somebody wants provider Y, and trying to not underestimating getting everybody on board before you suddenly roll up at their care home or care setting with the new tech that they never liked. I think that the piece in between there is incredibly important. I also like the idea from Ross about actually trying to measure the digital skills of your staff, because again, it's really easy to say things like, oh, everyone uses WhatsApp and Facebook and it's as easy as that, but not everybody does. And it's really important to address it. It may be the small percentage of the staff or something, but you don't want to marginalize them at all, and you want to bring them into the fold. So no, please do keep the comments coming in the chat. There's a whole fantastic conversation going off to my right. But Liam, from your perspective, how do you think communicating the benefits of digitalization to a workforce? Like, what are your stance?
Yeah, I mean, firstly, I just thought Mark explained that brilliantly. Such clarity. I wish I could explain things that way, but we've got Mark to do it. So that's great. I'm sort of more of a strategist, and I don't mean that by in a grandiose way. I just mean it's just kind of like how my brain thinks. So I use, because I was in sort of interested in sort of leadership models with customer service and project management before I came to healthcare. So I kind of think about defining problems in those ways, and how can I use those models to help, because that's my main toolkit, as it were. So for example, this, for me, this is about using the dark art of psychology in some ways, right? So first of all, how I try to engage my staff teams is to think about the pain points and the kind of pleasure points. It's a little bit of a reference to Tony Robbins, the interesting personal development teacher there, and he talks about everybody either sort of moving away from pain or moving towards pleasure, right? Which is a simple way of looking at things. So for me, then, the pain points of having no rostering system is, we haven't got one now. We mess up your holiday. We pay you wrong. You walk around. You can't get decisions. It takes ages to approve your holiday. How does that feel? That's annoying, isn't it? So I'll kind of rub that in a little bit to make them feel a bit of that pain point, and then say, oh, really exciting news. There's this great tech out there. Let me show you. Let me tell you about it. And so then I kind of flip it to the pleasure points or the benefits, if you will, which are the benefits to those to those particular people. And so then what I'm trying to do is to create a sense of excitement about this coming. So what I'm trying to do is say, hey, the directors, the owners, they really care. They want to make things better for you. They're good people. They mean well. So I'm trying to use it to sort of market and positively promote the care providers I'm working for. So I'm trying to stop them getting blocked. I'm trying to get them to get their head around it, and I'm appealing to their personal interests, because in my experience, that's the best and quickest way to influence people.
That's super useful. I think to summarize all of our points here is that how do leaders communicate loudly and often, and then again, and then do it one more time just to be sure, right? Before we move on, I have to share one story of the first system that I implemented, and this doesn't bathe me in glorious light, but I turned up to a care home, to the training room, and there was a good number of people. There were 20 people there ready to learn. It was a new learning system, learning management system, room full of people. Some of them come in from their day off. I walk in the room, I was like, hi, I'm Richard, we're gonna get the tablets out. Someone put their hand up straight away. I was like, yes, I got on. They were like, why are we here? Who are you? And there'd just been just a complete gap in the people have been told they needed to be there. They turned up, they'd come in, no one understood that there was a new learning management system. So trying to get that room back, I can tell you that was a tough couple of hours in my life, trying to win that crowd round to explain, hey, this is good and it's in your interests. So yeah, my single piece of advice is just, even if you think you've communicated to all of the relevant layers of the organization, do it again just in case, and check and hear what's coming back and hear what people are expecting, because it might not be what you're thinking. Moving on quickly from that sore topic for me, what do you think about the concept of building a digital culture? How do you go about implementing that so more and more people are entering social care with both employees and residents? They're going to be expecting it, as Mark said, I think, earlier. So Liam, you've seen the sector change over your years of experience. What do you think about the present concept of like building a digital culture, and how would you go about implementing it?
Yeah, I mean, I think it's quite a complex question actually, and hopefully Mark can cover off, some of the gaps in my knowledge. But I think again, with that sort of a strategic view, I think it's part education, and in some ways, for me, that would be painting a picture of the future, and what does that look like, and why is that exciting, and then what does that mean to us working in this care service, and what does that mean to us in terms of our commitments to the families and to the residents. So, for most of the people in care, they do genuinely care about the residents. They're usually committed to the families and know them well. So, again, it's putting it in a way that they can appreciate. But it's, I mean, the way I started to try and sort of build that culture in that organisation is to make it normal. It's to explain that this is normal, and actually doing things without a system, is actually far worse. I mean, I had an example of a care service I was running in Shrewsbury, and at the time we didn't have a care planning system, and a resident lost about half a stone in weight over a couple of weeks because something happened with their health, and we did address it and we did make sense of it. But at the time, I was thinking, why didn't I get an alert? Why I didn't get an alert? Because we're on paper care plans. So actually, people can be comfortable with what you've already got, but actually there's risk in what you've got. There's risk in bits of paper. There's risk in paper audits, because unless you keep up the action plans. So I think it is talking about the status quo. It's explaining why the status quo doesn't meet the needs of 21st century care and families, and then it's and it's talking about what does the future look like, and then what skills do we need to help you have so that you can be part of that.
I think that makes a lot of sense. Mark, what would you add on that, on sort of the concept of like how would you go about building that digital culture? I think Liam's there saying like normalize it. What other steps can we take?
Yeah, no, I completely agree with everything Liam was saying there. I think just kind of following on from what he said, it's around, you'll have some really positive stories of where it's gone well and the outcomes it's had for the people you support or your staff team. And I think it's about remembering those and sharing those. It might be that you've got a newsletter or a notice board in your home and kind of really shouting about, actually, we implemented X and it had this outcome on our staff team, or it had this outcome on the people we're supporting. In my organisation, when I started, I implemented digital leads into the 2 contracts that I oversee, because I get to make all the decisions, but I'm not the ones that are going to be using it. And I think I always remember I was a registered manager and having people make all those decisions above me and just kind of filter them down. And I was the one that then had to kind of fend off the staff that are unhappy. So I think for me, I'm always very conscious that that's how I was, and I don't want to be like that. So we implemented digital leads so that they can kind of scour the, what's out there at the moment. They can go to kind of the tech roadshows and bits and pieces and see if there's anything that will work for our service and our staff and the people we support. And I think I'm always saying to my teams, just think outside of the box. It might not even be something that's on the market at the moment, but actually have a look at what they're doing in kind of Japan, because they're so much further forward than we are. So many of us spend our time on TikTok. Actually, is there anything on TikTok you see? And I think one of the examples there is around, wheelchairs that you can move kind of just with your mind, as opposed to with without buttons and bits and pieces? And actually, is that something that we can invest in for people that are wheelchair bound? I think the only thing for me is, if you are in that position where you're making those decisions, but you're not going to be the one that is utilising it and being kind of on that front line, is being brave enough to kind of put your head above the parapet and say, actually, we need to involve X, Y, Z, because they're the ones that are going to be using this, and we should be getting their feedback before we make a decision. And I get that's not always easy to do, especially when you kind of get to that level of management where you're the one that's expected. I think I do it very well. I always, like I spoke about, I was a registered manager, so I always use that. And I always say, actually, at the end of the day, if you haven't got the buy-in from the registered manager, they're the ones whose name's above the door. They're the ones the CQC are going to listen to and agree with. So if your registered manager on the day of that inspection says that system, whatever it is that you've implemented, doesn't work, the whole organisation and the reputation falls on that one individual. So actually, you need to get that buy-in from the lower level to then, come back up the chain, so to speak.
That concept of empowerment, I think, that the people that are using the system should be empowered to make that decision, gets them more involved, potentially gets them more bought into the process, all of which we were talking about earlier. I think that's a really good point. As a slight tangent, I spend a lot of my time now pitching, essentially, talking about Sona to a wide range of audiences. And I tell you, when I'm talking to that C-suite and that senior or the project team that are implementing something, the demos are easy. They're coming, I'm showing them what it should do. It's fine. They love it. It's great. You demo to the home manager that's going to use that rostering system day in, day out. The organizations that are bringing them in, that's when I earn my money, right? Like, they're fantastic demos. They're so much more detailed because you've got someone that genuinely knows, well, what does it look like in this scenario? And how do you handle these scenarios? And that, I think, if I was rolling out projects now, I'd want that insight before I chose anything, right? Like, it's get them into that stage, and you find out an awful lot more about that tech provider by having that insight of someone that's already doing it. Even if it's on paper, they know how they schedule and they know the scenarios, and put them to providers, put them under the burn. Like, no, show me, click the buttons, show me how you're going to handle this. Is this going to make my life better? So I think that not only does it empower them, buy it in and get a better culture, I think there's a strong chance you end up with better tech implemented if you've included the people that are going to be using it from the beginning, because they know what's going to save them time. The other thing you said that was really interesting, Mark, there, that I enjoyed, I'm going to put you on the spot slightly, is this the idea of when something's gone well, shouting about it. And I think lots of organizations do sort of phased rollouts and things, and you have these examples. Do you have an example of something potentially that went quite well, but more importantly, how did you share that to the wider team to say, hey, this is coming, or this has happened, and it's good?
Yes, I think one example that I'll utilise is in the care home that I was managing kind of pre-pandemic, is that communication was a massive issue when I started. It was on, it was written handovers that staff either didn't see because they just came on and something was going on, or for whatever reason. And we moved over to WhatsApp, which was fine, but I knew that I used WhatsApp because my friends were on it, my family are on it, and actually it then just became an app for work. And I just happened to be listening to Sophie Coulthard talking around work-life balance, and she just happened to mention around WhatsApp and actually utilising other resources to communicate. And she spoke about an app called Slack, which works very similarly to WhatsApp. You can kind of have different channels and themes, and staff can interact with one another. And I remember doing a survey with my staff and saying, look, we want to change the communication method. We hear you that WhatsApp isn't working. It was better than the written, but it's still not where you want it to be. And we kind of polled the staff, and then we rolled out Slack and involved them in that decision process. And there are others available. You've got Blink that works really well. And we ended up with Slack, and I then left it for 6 months and then re-polled the staff, and it showed that work-life balance went up by something like 90%. Staff were saying, actually, we're more engaged. We weren't really using WhatsApp for exactly the same reason that I spoke about earlier, that they've then become disinterested in their personal and family life because all they saw it was a work app. So they stopped using that and utilised other communication methods. And I think it just goes to show that you might think something works well, or you might not think of or know of what else is out there. But actually, if you kind of utilise that feedback from your staff And then what I did off the back of that was that we would then talk to other care homes about it, like today talking about it. Went back to Sophie, who was the one that recommended it, and said, actually, I've written a paper on it for our board. Would you like a copy? So that you can use it like when you're talking again as a care provider. And I think it's just kind of shouting about when you've done something well, both to your internal teams, to those relatives, to the people you support, but also to the sector as a whole. Because I think we are digital, and I think we're probably more digital than we give ourselves credit for. But I don't think sometimes we're aware of what else is happening other than what's kind of put right in front of us. So I think we all know about digital care planning, but kind of communication tools and bits and pieces, I don't think necessarily, because it's not in our face all the time and there's no funding for it. It's something that we kind of just carry on doing, but don't necessarily improve. So I think it is about that kind of networking in with other people. And, you know, there's some amazing groups on Facebook, on LinkedIn, where you can just drop a message and say, actually, just started using this, just to let you know, guys, it's going really well for my team. Just a heads up in case you've got the same issues in your service.
I really like that. Again, it comes back down to communication, right? It's sharing with anyone that might be interested. And often, I think I'm often quick to write off, no one else, everyone will have solved this problem already. I'm sure I'm the last one to it. And often that's not the case, right? It's like, and even if it is the worst case scenario, no one listens, but it's always worth trying to share and be like, hey, here's some experience. I love that story. And as a slight tangent, yeah, I couldn't agree more. As work starts creeping onto WhatsApp, it has a much bigger detrimental impact than you would expect. You can't turn WhatsApp off because that's normally most people's main communication, right? So I admire the project as well, looking for an alternative, and I'm pleased it worked out so well. So we've procured some tech solutions. We're building a digital culture in the workforce. That's all good. How do we think that's going to impact sort of employee recruitment and retention? And I'll start with you this time, Mark. So in your experience with prospective employees, are they looking at whether a provider is digital or not? Is it an advantage in any way?
If I'm completely honest, I don't think they probably are. I think they're probably unhappy in their job for whatever reason, whether that's pay, because they're burnt out, whether they're just looking for a career change, or whatever the reason is. And I don't think necessarily in the sector we kind of think about, what digital solutions are you using? I think even, we just spoke about I don't even think you'd think about actually what communication tools are you using. I think you kind of join a company because of the values, or it's something that you're kind of aligned to in one way or another. I think as we go forward, it's definitely something we should be thinking about, because I think as we kind of move into that more digital era with things like, AI and bits and pieces, and it's coming embedded into everything we do and all the products that we utilize, I think it possibly will become a conversation that is happening a lot more. I think we know next year there's changes with flexible working. And obviously a lot of flexible working is only made possible because of the digital solutions that we have in our workplaces. And I think for those kind of people that have those flexible working arrangements, they would be the ones that actually are thinking, I want to leave my current organisation, but I need to make sure that the next organisation can offer me this as well, because this is what's giving me that good work-life balance. So yeah, I definitely think we should be shouting about it more. I think, if you're utilising, recruitment and digital systems, make sure it's in kind of your adverts, make sure that you're utilising it to the best of your ability. There's no point in having a solution that's not working, talking about recruitment there. Actually, if you're meant to be streamlining the onboarding, but you've still got staff that are having to ring people and get staff to bring in documents, if that online element has that, you should utilise that to kind of streamline that recruitment and onboarding process. I think there are some simple wins. I think, with AI and tools, and we use Blink in my workplace with kind of preloaded videos. So when somebody joins, on day one, they get a message from the CEO. From day two, they kind of get a message from whoever. So I think there are some really good tools out there. Again, it's about knowing what there is out there. I think in terms of retention, I think it's definitely going to help, because I think, like Liam said earlier, actually, when you compare digital to kind of the paper records and the old school way of doing things, actually you save so much time, and we're giving staff that time to care, which is actually all they really wanted to do in the first place. They didn't join to write reams and reams and reams of notes, and managers didn't join to do 101 audits and then have to do 101 action plans off what they found. Actually, those digital solutions can really shorten the time, the admin burden time, and get you focused on actually what you want to do, which is your teams and the people you support.
Other than the fact that I now have nothing to add, that's a fantastic answer. I think you've covered off from the retention perspective perfectly. This idea of, saving time means managers can do. Nobody got into any industry, to be fair to it. Do you know what I really want to do? I really want to use good workforce tech. It's like, no, I want to look after residents. That's what I want to do. I want to care for people. I want to manage my team and have an excellent team. I couldn't agree more. Just quick, for those in the chat, I'm going to ask, I reckon, panelists one more question maybe, and then we'll pivot to any questions from the audience. So the chat's nice and busy. If you anything that you want to put to Mark, Liam, or even myself, if you want to put that in the questions now, we'll wrap up with one more question between us, and then we'll turn to them. Liam, start with you. Same question, but this time we've talked about retention and recruitment of the employee. But what about the residents? Do you think that the resident experience gets impacted by digitalisation? And do you think that would have an impact on where maybe you joined as a resident or a person you supported, and where you went, depending on the tech stack?
Yeah, I actually think that, I thought Mark's answer was excellent about the staff thing. I had some experiences running a sort of group of homes, and then one with tech and then one without tech, and I found that actually, if you get the tech right, it can be attractive to staff. Actually, that staff would come to your home because it's easier to work there, easier to book holiday, easier to pick up shifts. So I'm not disagreeing with Mark, definitely not. But I had some experiences where actually it was a positive. But in regards to your question, in regards to would residents like it? There's some really good tech out there. Familio, which is sort of capturing sort of stories. There's some great tech around. Live stories. There's acoustic monitoring to stop people falling at night and stuff like that. So I think the use of some specific technologies can improve the experience of residents and reduce risk. So I think where care services are using those, I think it can be an actual benefit, to make it actually more attractive. But I think it depends which tech you've got.
That makes lots of sense. I'll extend the question to you there. Sorry, Mark. Before we turn to the audience, so from a resident perspective, what do you think the tech stack matters, if at all?
I think it depends on what the outcome's going to be. So I think firstly, and I've spoken about, you need to think about mental capacity, and is it something they want? You can't force it on them. And again, a bit like what we said with staff. Actually, if you're trying to force it onto them, they're never gonna use it. I think for those people that we support that want digital solutions, whatever that might be, it's about upskilling them and giving them the tools. And I'm kind of putting my learning disability hat on here when I speak, because I think younger adults, working age adults, they're probably using tech already. They've probably got a mobile phone. They've probably got a tablet. They've probably got all that in place, actually. And then it's just kind of building on those skills that they've already got. A lot of it comes down to actually showing them, being able to get kind of easy read guides, that kind of thing, which isn't necessarily always the easiest, because the world isn't geared up to supporting people with accessibility needs, unfortunately. But I think we should definitely be embracing tech for anybody that's in our services that wants to use it. And I think it's about showcasing, like I said earlier, those positive outcomes. Actually, I know one service that is in the area where I work, where they use, and I believe it's Tenor, but they have built-in UTI strips, so actually the care home can then see whether there's UTIs really early on. And I know that they shout about that all the time. Actually, if your loved one lived in our care home, we'd be able to identify that early, less hospital admissions, less, medication. And I think there will be things that we all do day in, day out that we just think is the norm. But actually, if we pull them out, probably isn't the norm. It's probably setting us aside from what everybody else is doing.
I think that makes lots of sense. It brings us back to, again, the sharing is why people can help, because you think it's normal, but potentially it isn't. Great point there from Lizzie as well, being it's not just the person you support. I love what you were saying about sort of consent and mental capacity, and it being outcome driven. I think all tech should be outcome driven, but in the families, potentially the ones as well, that with the tech in place, that will have a bigger input about, actually, I want to be able to see X or Y, or I have an expectation to be able to do Z. Last question. It's come in the chat. There's been a bit of a discussion around it. Just put it out to either one of you. It's a bun fight to go first. Younger generation and tech. I think on the others, do we think there's an expectation now with with a workforce of 17, 18-year-olds coming in, that they would have a higher bar maybe, and a higher expectation to be doing things digitally.
Yeah, I definitely think we need to be thinking about first of all, we've got to attract the younger generation into social care. I think that's the biggest thing. I think we need to be looking at work-life balance, and actually, is there tech that enables that work-life balance? And there probably is out there if you look. I think, I look at my eldest daughter, all her friends are on mobile phones. They've all got, the latest technology, and we need to be making sure that we're kind of keeping up to date with what they're utilizing and more, but also looking at what other sectors are offering, because actually if we're not competitive with what the other sectors are doing, then we won't attract them in the first place, and if we have attracted them, we won't retain them.
I couldn't agree more. Any final thoughts, Liam?
Sorry, just about the young people coming. Yeah, absolutely. I think the sort of quaint tradition of in the afternoon, the care providers sitting with tons of blimmin' paper files. That's got to end. For God's sake, it's got to end. And as Mark said, whether it's for younger people or middle-aged people like me. It just makes sense. It makes things easier. It's quicker. It's more efficient. You've got one version of reality. There are so many advantages for using a good, well-chosen piece of tech. But yeah, absolutely right. For younger people more used to doing so much on their phones. You see it walking down the street. There you see people crossing the road, with their mobiles. So it only makes sense for new care apps to sort of fill that space. That would be very comfortable, wouldn't it? So yeah, absolutely. I'm totally an advocate in that sense.
Fantastic. In which case, I think we are at time. So that leaves me to say thank you so much to Mark and Liam. It's been a fantastic chat with our differing views. And I think thank you for your time. And I'll hand over to my colleague Hemel, who hopefully will arrive on the stage in a moment. And for those that are interested, Hemel here will lead a very short demo and a little oversight of what Sona is and what it could do for your workforce. Thank you so much, Liam and Mark.
Brilliant. Thanks, everyone. Thanks, Rich. And as mentioned, I'll be doing a very short run through of the Sona system. Let's go straight into the demonstration. I should share my screen and move over. Brilliant. Right, so there are two sides to the Sona system. There is the admin side. I suppose this is where head office users or regional managers or operations teams or local service managers kind of interact with the roster and send messages and approve annual leave or access reporting or build newsletters. There's lots of different things you can do on the system. Then there is the frontline app that your support workers, your care staff, your nurses, your catering staff, cleaning teams, whatever it might be, would download and use to kind of access their rota and experience their work through that app device as well. What I'll focus on today is just a quick summary about the admin portal view, which is what we're looking at currently as well. So one of the things I'd highlight is you can see there's kind of a big hierarchy page on the left-hand side. So this is where you can access all of the different features you might need to access. Within site selection, we actually have 4 different types of services set up: a residential care service, which is probably a more kind of fixed way of rostering, a supported living service where you'd probably roster against people's individual care package needs, and then a home care roster as well. So what I do today is just talk very briefly about all 3 and why it is particularly useful to think about rostering differently and to have flexibility in how each of your individual service managers can roster. So let's go to the Angel View residential care setting first. So when you click on any service in Sona, and obviously that will reflect the permissions you have, so you only see services that you should be seeing and have access to. You'll see that there are 3 different rota views that are then triggered. There's a staff member view, a by role view, and a people we support view. These can be configured on or off depending on what you need. But essentially, if we start with the by staff member view, and we're kind of in the middle of a busy roster view here, you can see there are a range of different shifts and then also some information on the left-hand side. So I'll talk about the 2 critical things. When you're building a roster, one of the first things you might consider is which of my team members needs to work hours this week. So Sona can host all of that information. Sona can even be your source of truth as well for your contracted hours. So this will tell you that Aisha and your team needs to work 40 hours this week, but is only contracted for 56 hours at the moment, or overly contracted at 56 hours. You may decide to kind of move some of Aisha's shifts around. We can see that Albert here is on track to work the correct number of hours because it's 40 out of 40. We can see other members of the team. So you can see Anne here is actually under contracted. So it immediately gives you this traffic light system that allows you to kind of adjust who's working when on the rota. If you wanted this to include hours worked in the last 2 weeks or hours worked this calendar month, those are the kind of things we can add in with that traffic light system. You can also have your bank team members present here as well. So it doesn't have to just be people with contracted hours. If we go to the top of the screen, the other thing I'd highlight is this concept of open shifts. So essentially, at Sona, we're really passionate about helping you as a service manager to quickly fill gaps in the rota without having to twist people's arms or make lots of phone calls. In Sona, all you need to do if you have a shift that needs to be filled is click on the day where the shift is required. Choose the shift type that you need worked. So let's pick a night shift here as well. You can also see here there's a very complex kind of way of like handling skills and requirements as well. So you could be a care assistant, or it could be a care assistant shift that requires dementia training, for example. But what it is, I'll pick this night shift that we need worked. I'm going to select open shift and save. And then what I'm going to do is publish that change as well. And essentially what you're doing with that process is you're essentially picking a shift that you know that you need worked and asking the Sona system to go out and find users who could work that shift and sending them notifications in the app. So Sona will understand what skill types exist. So essentially who could work as a care assistant within at Angel View, which is one of your services. It will also take into account how far could somebody reasonably travel. So we could let everyone within 20 miles know that there's a shift available, but no one outside of that 20-mile radius. We can take in compliance variables into account as well. Obviously, if you're already working a shift, you won't see that shift either. So it does all of the thinking you traditionally have to do before you can cover a shift, and then it pushes it out to the people who are most likely to work that shift. And you can even have a tiering structure there as well. So you may want to start by sharing access to overtime with people who work at Angel View full-time, and then going to people who typically work at other services, or you may want to adjust that by a different metric based on pay rates or experience or something like that. I'll quickly talk about the two other ways that you might consider looking at rostering. So the first is what we call our by role view. So essentially taking your occupancy or your dependency models and then trying to have that information visible in the roster in an accurate way. So for example, here we have grouped care assistants and registered nurses at Angel View into two separate groups. The reason we're doing that is because we have targets for each. So we know that we need to have a certain number of care assistants each day. Here you can see we've broken that into an AM, a PM, and a night slot. And we know we need 3 care assistants in the morning, 3 in PM, 1 at night. Now, this structure can be completely different from service to service. We can keep the AM, the PM, but just change the times that apply. We can just have a total number of hours. For nurses, we just say you need a certain number of people on site 24 hours a day as well. And that can also be present in the system. So essentially, you've got 2 core pieces of information that you need to know before you roster. What about the contracted hours my team need to work, but also how many people do we need overall to provide the adequate level of care or support. And on occasion as well, it's a useful way of saying, are we overstaffed? Do we have too many people working, etc., and a way of potentially controlling your labor costs too. I'll very quickly talk about the supported living version of that view. So essentially, if you did want to see your roster based on people being supported, we can also have that present in the roster as well. So you can then decide, okay, which of my team members can provide one-to-one care to Anna? Is there a shared care requirement as there is for Harold, as well as Jenny? So you can add shifts into Sona and then tag the people who are receiving care as well, which is another kind of unique way of rostering that Sona can facilitate. And the best part of all is obviously all of this is configurable as well. So we can change role types, we can change descriptions, etc., in any way that makes sense for you. And yeah, I'll probably stop there just before we get to time. But if you are interested in learning more about Sona, please do reach out to us. We'll also be at the Registered Care Manager Show at Excel this Friday. Thank you very much.
Thank you everyone for joining. That's all for today. And we really hope to see you at our next webinar as well. We'll be sending out the recording shortly. And yes, thank you very much for participating and a really amazing conversation. Thank you, Hamo. See you all next time.
Thank you.
Goodbye.
Bye.